So let's talk about the peritoneal dialysis protocol. First thing is to determine the fill volume. If the catheter was placed immediately and peritoneal dialysis needs to be performed, then I recommend that small fill volumes be started to avoid leakage. The next is determine fill time. Again, by gravity or manual peritoneal dialysis, fill time is about 5 to 10 minutes. The next is then to set the dwell time. Again, the longer you dwell, theoretically, the more water you'll remove and the more molecules you'll remove. If you're going to have a 1 hour cycle, 60 minutes, then a good dwell time would be 40 to 45 minutes. If you're going to do a 2 hour cycle, then a good dwell time is 100 to 105 minutes. If you're going to do a 3 hour cycle, then a good time is 160 to 165 minutes. Next is to determine the drain time. In a 1 hour cycle, usually the drain time is about 10 minutes. Number 2 is then to record the ultrafiltrate. Number check electrolytes. This is especially important in the initiation of peritoneal dialysis. I recommend checking within 2 to 4 hours. After that, once it's routine, one can check once a day or twice a day, depending on the resources available. Number 3 is to assess the ultrafiltrate, the net removal of water. So once you start peritoneal dialysis, periodically you need to reassess. Do you want to increase the ultrafiltrate or do you want to decrease? Number 4 is to weigh the patient daily. This is very important, as this is how we determine patient's fluid status as well as the ultrafiltrate. And number 5 is to check blood pressures frequently, especially in initiation of peritoneal dialysis. If you have increased or very efficacious ultrafiltration, there's a risk of causing hypotension. Number 6 is if you have to temporarily discontinue peritoneal dialysis. It's very important to keep the catheter site clean. So the steps to do this is 1, to completely drain the peritoneal dialysis fluid, then to fill with new peritoneal dialysis fluid, but only to 50% of your fill volume. So you don't want to fill completely, but you want to leave a little bit of fluid into the peritoneal cavity. This will allow the catheter to flow freely in the peritoneal cavity and prevent it from touching other organs, which may cause blockage and complications of peritoneal dialysis in the future.
Please note, the amount of peritoneal dialysis fluid inserted during temporary discontinuation may vary among institutions.